As the healthcare provider gets larger, as they take on more complex clinical work, the difficulty of proactively managing your patient relationships that does not increase linearly, it increases exponentially. So I'll give you an example. Let's say that you're a private hospital, you're providing MRIs, surgical interventions, orthopedic surgery, respiratory surgery. You're providing a clinical service that is very complicated. And so the nuance, the accuracy, the precision with which you need to deliver that clinical service goes through the roof. It is entirely different than going and receiving an injectable at an aesthetics clinic or a hygienic cleaning at the dentist. So as you get into more complex clinical care, the nuance in how you manage that follow-up becomes much harder. And so now you've got a finite capacity in your front office team, in your administrative team, that are managing these don't mess it up situations. There's a whole lot of don't mess inside of these larger organizations because one mishap creates enormous clinical risk, legal risk, downside for the organization. And a $100 million lawsuit is a huge problem by comparison to one more happy patient. And so you end up solving for risk. You end up focusing on getting things right as opposed to engaging and supporting the patient. So you've got an entire front office team that's focused on trying to move these components, these gears, these locks, these turns along the patient journey. And it's too easy to lose sight of the person at the end of that journey. It's too easy to lose sight and to disconnect with that patient because they're not physically there. They're not currently going through that process. And so these larger healthcare organizations, incredible in delivery, phenomenal in clinic experience, absolutely horrific patient experience. And one of the collaborators at Coherent recently went to a large private hospital and said the care they received in the room, extraordinary. It felt like going to a 5-star hospital. You walk out of the room, the intake is slow, it's broken. The follow-up is slow, it's broken. The inconvenience of needing to go back and fill out forms again for a different service is slow, it's broken. But that enablement, that layer of enablement of relationship around the provider doesn't live in your practice management software, in your electronic medical record, in your hospital system. That's not what those engines are built for. Those engines are built for clinical compliance. They're built for operational efficiency. They are not built for delighting your patients. And if you want to win in 2026, in 2027, in 2028, you need to delight. You solve for delight. That is the thing that matters.